at the minutes from the last meeting?
Yes.
Is there a motion for approval?
Second.
All in favor say aye. Aye. The minutes from the last meeting have passed. Next is consideration of the consent agenda. Committee members, do you have any items to place on consent?
Choking.
Yes.
Councilman.
I would like to place items 4, 6, 9 through 13, 15, 18, and 19.
15. And administration would do 18. Okay. So that's item 4 on page 1, item 6 on page 2, items 9 and 10 on page 3, items 11, 12, and 13 on page 4, item 15 on page 5, and then item 19 on page 7.
Madam Chair,
Yes.
it's on item number 6, we have a correction of the amount.
Okay.
Instead of 250,000, it's 150,000.
Okay. You would note that correction for item number 6, the amount is changed to 150,000. Madam President, does she have any? I don't have any. Okay. All right, is there a motion for approval?
I move approval of the consent agenda.
All in favor say aye. Aye. The consent agenda passes. I don't know if you guys heard us, but we placed items 4, 6, 9 through 13, 15, and 19 on consent. So if your item was placed on consent, you can go enjoy this lovely day. All right, first item is item number 5. This is the Alabama Greek picnic on August 3rd through 6th, 2023.
Second.
Yeah. Go. Put it on that. Down there. Ian.
This is yours.
See you at the hot table. Okay, this is item number 5, Alabama Greek picnic.
Well, good evening. My name is Cornell Wesley. I proudly serve as the Director for the Office of Innovation and Economic Opportunity. I have two colleagues here with me who represent the Alabama Greek Picnic. What we have here is a 3-day event that has been in Birmingham for several years now. This would be the city's first participation in said event. Brief overview of what the Alabama Greek Picnic represents is that it's, again, a highly anticipated summer event designed to provide Alabama members of Greek-lettered organizations a unique experience to unite, serve, and network in a central location. What I believe is most important is what the success of the event underwrites, which is a foundation. That foundation then takes those proceeds and allows it to be leveraged for the purposes of ACT and SAT preparation, mentorship alignment, as well as college tours. So while this is probably not a big economic driver in terms of economic development, we do see it as a huge opportunity to showcase the history and the contributions of African American Greek letter organizations for the purposes of modeling what we hope our youth will see, and also connecting them with those opportunities for ACT, SAT prep, as well as college tours. Specific questions to the outline of the program, I have Ms. Shemaine Pruitt, as well as Mr. Tamarcus Pruitt here, who can answer additional questions.
Madam President, do you have questions?
Yes, thank you. I am familiar with this event, so I am excited to see it's not just a party with a purpose.
That's right.
It has a meaning as far as, I know how important it is for parents for financial applications.
Mhm.
What is it, FAFSA, ACT, and getting our children ready or prepared for that, because that can impact how much money you're going to
That's
spend
right.
on child's education. So just tell me a little bit more. Is it a multi-day event, or and is it at one location?
Well, it's a weekend event, starts off on Thursday, August 3rd, it goes on to August 6th, Sunday. So it's a 4-day event, Each day we have a purpose, either a sock drive or a belt drive at each, event throughout the weekend. Then on Saturday is the main community service component.
Thank you, because I know some of the organizations. And, so much of our organizations are based on a foundation of community service,
Right.
community projects. So I'm very excited to see this as well. I just want to know for public purposes, does this only have to be a member of a Greek organization, or is this just to, what is your audience?
Well, I mean, our target audience is definitely members of the Divine African Greek organizations. However, we're open to the public. We always have different members that are Greek, but we also have people that come that are not Greek at all.
Those are my questions.
Thank you, Council Abbott.
The Divine Nine organizations. Well, it's memorable. Who are the Divine Nine?
So we have Alpha Phi Alpha, we have Alpha Kappa Alpha, Delta Sigma Theta, we have Kappa Alpha Psi, we have Omega Psi Phi, we have Phi Beta Sigma, Zeta Phi Beta, and we also have Sigma Gamma Rho and Iota Phi Theta. I've never had to run them all on.
That was my test.
But did you know them?
I knew some. I got around it.
She ran it too.
I used to get around on that. That's why. Well, I'm a little bit confused. Okay, we have an agreement with the Alabama Greek Foundation where they're gonna promote, market, and conduct picnic. But then we're giving incentives to the Prosper Foundation for $15,000. So what is the
Probably.
agreement for if we're giving
That's
the
a
money to
typo. That's a
somebody
typo.
else?
That's a typo. That's a typo. It shouldn't have to say Reed Prosper Foundation. It should read Alabama Greek Foundation.
Oh, well, that does make a big difference. I wouldn't have put this on, I wouldn't have asked about it if it had not been so confusing. So the people that are getting the incentives are the Alabama Greek Foundation Incorporated.
That's correct.
Yeah, that makes a difference, because that's confusing. And then the $15,000 is going to go for the purpose of what? Is it to help provide the publicity for the event?
It represents about 15% of the total expenditure cost, which is coming in around $95,671. So that can be in the procurement of the talent or the underwriting of said ACT, SAT prep.
We're also giving away, 3 scholarships this year at the picnic, $3,500 scholarships from the foundation.
Okay, the public money can't be used for scholarships.
But we just talking about.
Okay, yeah, we learned that with our friend Larry Lane. So the other thing is, you said that you have, collections that you do of socks and,
Yes, ma'am. So what we'll do,
who gets the socks and the belts?
well, we plan to give it to, yeah, we always do the Banner Project, and so we plan to partner with them and just basically donate the socks and belts that we collect specifically for the homeless members of the city of Birmingham.
Okay.
So we'll do that, for the events on on Thursday, Friday, Saturday, and Sunday. And then on Saturday and Sunday, we're doing Be a Match for, Bone Marrow Drive. We'll do that, and then we're also gonna have voter registration, and, I think that's it for our community service initiatives for this year.
Well, that's a lot. Okay, thank you. That answers my questions.
Okay. I don't have any questions. Well, I think that's a motion. A second. All in favor say aye.
Aye.
Item number 5 passes. Good
Thank you.
luck. Thank you very much.
Thank you all.
How did you pass that test?
A little nervous.
They were gonna cover you. They didn't get it right. All right, item number 7.
But see, I wasn't counting. So she could have left one out. I wouldn't have known.
No, she did a good job. Number 7,
Yes.
This is a lease agreement between the city and RJ Building LLC. They are leasing a space, which is about 54,136 square feet.
It's the old Majors building.
Move down.
Second.
Chief?
Good afternoon, Mayor. Corey Wells, serves as the Fire Chief of Birmingham Fire and Rescue Service. So the RJ Building LLC. This facility, we lease about 54,000 square feet of their facility. It's basically our logistics hub where we keep supplies and reserve apparatus, and we do ladder testing and ladder repair and hose repair. So this is our logistics hub. And it's for $129,600 per year.
Councilor Abbott, do you have questions?
I do know. Okay, it says that RJ Building LLC is going to lease a space of 54,000. They're going to lease it, they're not leasing it, we're leasing it, right? The
We're
city of
leasing it.
Birmingham is leasing it from them.
Yes,
Right.
correct.
Okay, well, that was what had me kind of bumfuzzled, was trying to figure out why RJ Building was involved in leasing space when we wanted to lease it. But it's just peculiar wording, it doesn't really have anything to do with what you're really doing. So the city of Birmingham is leasing from
yes,
RJ Building, which is Mason.
correct. And this is a renewal. I think we've been in this building over
Over
5
20
years.
years.
Okay, thank you, that answers my question.
Madam President,
I don't have any questions.
why haven't we bought this yet?
I mean, it would be ideal, but I think we're trying for a long term to try and find more space for not just Birmingham Fire and Rescue, but a lot of other departments.
If there's a motion and a second, all in favor say aye.
Aye.
Item number 7 passes. Thank you, Chief. Next item is item number 8. This is an agreement with the Birmingham Times Media Group. They will provide weekly print and online advertisements to inform and educate the public for an amount not to exceed $65,000.
Move the item.
Second.
Jeff, is your item?
Madam Chair, members of the Budget and Finance Committee, are there questions?
Yeah, I have some questions. Madam Chair. So we're going to have 52, weeks of ads of some sort that we get for this money, right?
Yes.
And then they're going to deliver and distribute 50 copies of the newspaper. Where? Out on the street, or distribute, like, where are they distributing it?
Now, I can't definitively give you that, that answer, but I know they deliver them here every Thursday. I don't do a count. I know they deliver them throughout the building. But if you need to know the count and the locations, I can secure that information. But I do
I
know,
was just curious to whom they were delivering, since it was like only 50 copies.
they bring them to the office every week.
Oh, they're for us.
Yes.
They're the ones that are in our little mailboxes. I got you.
Constituents come pick them up,
Mhm.
visit the office.
And we leave them on the first floor also for the public to grab and read.
So you can hear like a Citizens Trust Bank and other
Mhm.
different places. So. And we do have good ads that are in there, so,
It's a 59-year business.
yeah.
They haven't missed a week of publishing the newspaper. They employ 7 people. They have 45,000 viewers, both online and through subscriptions.
How many?
So 45,000 per week.
Oh, that's good.
Because I think they were doing a thing where they were trying to do a holiday each council. Was that from the time?
Well, the publication, or the ads that we are able to submit come from the recommendations of the council. So there's free range in terms of what we can advertise. And technically, what Councilor Abbott pointed out, 52 ads or 52 weeks of advertising, actually you receive 104 because you have the opportunity to do a digital ad in addition to the printed ad.
Oh, so it's like Lanyard, you get something extra for your,
Yes, ma'am.
okay, so it's not just the paper, it's everything, okay, 104 ads. Okay, well, that was all my questions, those were all my questions.
Madam President?
I don't have any questions.
Okay, I don't either. There's a motion and a second. All in favor say aye. Item number 8 passes. The next item is item an agreement with the Birmingham Zoo, an amount not to exceed $20,000, and this is to provide community-based education workshops, exhibits, and presentations to parents.
Yeah.
Second.
Jackie, see you again.
Yeah, my question is this discretionary?
Yes,
And
it
is
is.
it mine?
Yes, ma'am, it is.
Was it supposed to say it was discretionary, like the one on item 15, and somebody just forgot?
I mean, we can make that correction now. I don't want to put that onus on anybody else to have, oversight of that. I can make the suggestion that the correction is made now.
Okay, we're gonna have for fund sources, district number 3, discretionary funding.
Yeah, I think it's just good to put that on there, because we all have our discretionary funds, and I looked at this and I thought, I wonder if that's mine.
Yes, ma'am, it is.
Because I have not memorized everyone's little code, their funding source, 50-digit number.
So Council Evans, how often you do the workshops?
Workshops.
At the zoo? Or is it just?
Educational workshops they'll provide.
Oh, they do the workshops.
Oh, you just have
You know,
to
so
support
they,
Gotcha.
yeah, we're paying for it, but they do it. We know nothing about animals except that, they're taking care of them and the public enjoys going to see them. Last year, we funded food for the animals since the city had cut off most of their money, and we wanted them to continue to eat.
Now, counselor, we did not cut their funding. We didn't cut their funding. I wanna publicly say that we did
Their
not,
funding was cut so severely,
because
they had
counselor.
to go on diets.
So, Madam Chair, I just publicly, because I don't want the public to think that we reduced their amount. We reduced the amount because the contract's expired. But we also entered into another agreement with the zoo. There was an incentive-based agreement to try and offset the cost that was cut from 2 agreements that expired.
Yeah, but while their money was cut, the animals still wanted to eat, just like we did. COVID didn't make us any less hungry. So anyway, okay, so it's.
Well, I
also
would say
good.
as a board member also that the animals were being fed.
That's good. Dinner for the animals. Okay, so we're just gonna fix item 14 to say District 3
Yes, ma'am.
discretionary funds, and everything will be lovely.
Yes, ma'am. Okay, there's been a motion and a second. All in favor say aye.
Aye.
Item number 14 is passed. Next item is item number 16. This is an agreement with the City of Birmingham and Jefferson County Board of Health to fund the implementation of Jefferson County Hospital Link Violence Intervention Program, which is offered to provide hospital-based intervention and case management to victims of gun violence to address and reduce the gun violence in the city. The city will award funds to the board in an amount not to exceed $2,103,312 for a term of 3 years and support of the program.
Oh, yeah. Second.
Okay, Mr. Hatcher, Dr. Wilson, good to see you.
Good afternoon, good afternoon.
Yes, so Dr. Wilson, I still have your little packet from, it's a big packet from public safety.
Wow.
Yes, well, can you guys tell us a little bit more about the program
Yes,
or the item?
and I'm just gonna turn it over to Dr. Wilson, and then discuss the program and where they are at this point.
Sure, yeah, I think all of you are familiar with this. I came to the city council in December 2021 to present this idea, and since then, the health department has awarded a grant to the Offender Alumni Association to start the program. And it took a long time to get to that point. The staff had to be trained. They started seeing their first clients back in March, April of this year. The original plan that we presented to the city council was, the health department was funding the first year at $1.1 million approximately. The plan was to use city funding for years 2 and 3 for this amount that you have here, the 2.1 million, to expand the program, basically double this amount of clients that they could handle, plus add some support services. So we're still basically following that, except that because we want to make sure we don't leave any ARPA funds on the table, we modified this slightly so that all of this funding would be, from the city, would be used for all of the program for year 2, rather than year 2 and 3. My hunch is that we won't be able to spend all of it in 1 year, because of things like the time it takes to hire people, the challenges with hiring people, things like that. So, if we go ahead and try to spend all of it in year 2, and it ends up spilling over into the second year, then we're fine. We won't run up against the deadline. Hopefully that makes sense. And then the health department would then resume funding after that's out at the higher level, and or work with OAA to find additional grant funding from federal sources or other sources. And just as I said before, I just want to say the health department is committed to funding that at least $1.1 billion indefinitely. And that's our intent.
Madam President?
Yes, thank you very much. And hi, Dr. Wilson, glad to see you, and Mr. Hatcher. Those were going to be my questions, and I think maybe we did, because I was thinking of year 1 versus what we're doing year 2 and 3, and when it comes to the ARPA dollars and the sustainability. That's just what my thoughts and my question is centered around. So I think you sort of answered that for me earlier.
Yeah, I mean, if worst case scenario, well, there's all sorts of worst case scenarios, but as it currently stands, if the worst case scenario would be that we could not maintain that expansion, but we would revert back to what the health department's committed to providing. This is a hot topic, obviously, not just for us locally, but nationwide, and there are a lot of federal dollars out there that we think we can go for. And maybe local funding in the future, maybe city funding, who knows?
And what you're saying, this is this hospital-based intervention, this type of case management. You're right, across the nation, I see other municipalities or health department, they're trying to partner public-private sources to do this type of thing. Because I was in a public safety meeting with National League of Cities, when we just went to their summer leadership meeting, and you have certain cities that are kind of entering into the same thing. So I wanted to know, within the plan, now I know there's a lot of monitoring because it's ARPA dollars. Just want to know what type of reporting as a council we could expect, just to know how we're proceeding and how this is the success or what the outcome.
Yeah, the plan is to collect a lot of data. So when the violence intervention specialists first interact with the clients in the hospital, they do a big intake process where they start gathering a lot of information, and then they continue to do that after they leave the hospital. We're going to be working with data people that work for UAB to help track this data. We have a data system that the data will be entered into. And the health department will also provide some monitoring as well. But the type, I mean, certainly some of the personal health information we would not be able to share, but some of the bigger picture numbers, like the number of clients served, the outcomes, things like educational attainment, job attainment, whether they were involved in repeat violence or victims of repeat violence, things of that nature. The types of services that would be that were provided for the clients, such as mental health counseling or counseling for trauma, or in addition, other services that are related services for the families of victims or the children of victims.
And that frequency is included in the
It's in the
frequency of
agreement.
reporting.
Yeah, and we're going to, they're going to be submitting quarterly reports with the information, and we will definitely make that available, either directly to the council or some type of, we're also working on a public-facing reporting system to report what we're doing with our ARPA dollars as well. So we'll probably post it there, but we'll give you all, the council, a more detailed, breakdown of the information provided, of the data provided.
And, excuse me, I was assuming you were talking about the program features and the outcomes and not the financial reporting, which of course.
No, I
job readiness, employment training, substance abuse treatment, shelter, emergency housing, transportation, education. So it's really kind of dealing with the wholeness of the person. So it's not just, dealing with the mental health, it's really changing people's lives. Because I would love to see the data for the different areas of Birmingham that have an increase in gun violence in this program. Have they targeted more people? And I know we can't have all the information, like say for instance, they say Norwood has high gun violence. Did they find a lot of people that came to the hospital? Did it decrease? I would like to know those numbers.
Yeah, I think we should be able to get some data on, at least on a fairly large geographic scale, where clients come from. It is tricky with HIPAA, more than people realize. We went through this with COVID, where anything below county level data we couldn't share. But I think we can figure out a way to at least give you a sense for that. Now, in terms of targeting clients, I don't know that will be relevant, or if that will be something we do, because really the way it is working, this is a program for Jefferson County residents. We know that a lot of them will be Birmingham residents, just based on the statistics of gun violence. But the way it works now is it's pretty much, as long as somebody meets the criteria that they're within the age range that we're targeting, and that they live in Jefferson County, the main selection criteria otherwise is their willingness to participate in the study and to consent.
Well, I shouldn't say target, but we just want to see, like I said, we want to be able to come to our constituents, like for me, West End, and say, okay, with this program, the gun violence has decreased in West End.
Right.
We're talking about the known areas of gun violence, which I know
So-
overall as a city will decrease, but.
Right. So unless we start getting lots and lots of demand for more than we have capacity, we probably will not be targeting, but we can certainly be looking at the impact that it's had, or which, who's being.
Yeah, I didn't mean target, we just
Yeah.
need to
Right.
be able to show there's some type of change in our district.
Yeah.
So that is one of
Yeah.
Well, yeah, I was gonna ask about measurements too, because if you don't measure, you don't know whether you succeeded.
Right.
But to initiate this, someone has to come to the hospital with an injury from
Violent injury.
some kind of violence that
Yeah.
they,
It's virtually all gunshot wounds.
and how cooperative are people? Is this meeting good cooperation, or do people wanna keep quiet and go take care of it after they get out of the hospital themselves?
I think some of that's to be determined, to be honest with you. One thing we've noticed early on is that the way it works, the way we've had to set it up is first the hospital staff approaches the client to see if they're interested in the program, and would they then be willing to meet one of the program violence intervention specialists. That's just the process that has to work. We can't have people just showing up in a hospital room and saying, hey, I'm in this program. So that has been identified as a barrier. Most of these are black men, and a lot of the hospital staff are not black men. So there's just been a little bit of a cultural barrier there. So what we have done recently with the help of Rick Journey, with our department, has created a video with the actual violence intervention specialists who come from the community. Currently, they are black men. They're not, we're hoping to have a little more diversity among the staff, especially to get a woman at some point. But it's actually a video of the violence intervention specialists talking about the program and what they have to offer. And so our hope is they will see a more familiar face, somebody with a lived experience who's from the community that the potential clients can identify with. But yes, some people don't want to be involved in this. They do want to just go about their business. So there's a little bit of convincing people that this is something that is worthwhile.
Well, thank you. That was something I wondered about because of the, don't snitch kind of attitude that people have is,
Right.
I wouldn't consider it snitching, but, a lot of people do.
Right, and this program, as I've stated before, is also not police involved at all. I mean, the police certainly will want to talk to people who get shot, but this program will not be a conduit to police, nor will it be reporting to the police, because that's been identified by the community as a red flag for people to not be involved or put people at risk. So, yeah, there's plenty of business out there, and I do caution that it's going to be hard to impact the overall numbers because the numbers are so huge, unfortunately. And this program is currently starting small. It is going to reach a minority of the people that are coming into the hospital with gunshot wounds. UAB as a whole, trauma center, last year saw 1,300 gunshot wounds. So it's just a huge number. And we're talking about a caseload of about 25 people per violence intervention specialist at any given time. So as you can see, it's sort of a drop in the bucket. But some of those are from out of the county. But we're talking about at least 700 or 800 people are from the county. And this, as I've said many times, is one small piece of a much bigger puzzle to try to address this issue.
My questions are answered, it's pretty depressing.
Yeah. Well, I'm happy to see this, because I was really wondering what was going on when people were asking us that. And I know it takes a long time to see the results from this, but I'm really happy to see it's going. I would like the quarterly report, maybe a committee of the whole, to be honest. I know that a little bit more work on you, but I think that'd be good for us, anyone in the public that may want to see it. So, and so we can, especially in the beginning, we can ask any questions about what's going on. If that's okay. Yeah, that's okay. Was there a motion? Was there? Okay. All in favor say aye. Aye. That item passes. Thank you, guys.
Thank you very much.
This item is number 17. This is a public transportation services agreement between BJCTA and the city of Birmingham. And they will provide services as part of the transit system. This is the BRT and paratransit. And this is for an amount not to exceed 14 million, which compensation is 11 million for 6 routes and for fixed routes, and then 3 million for BRT services. Hey.
Good afternoon.
Good afternoon.
First of all, I'm Glenn Dickerson, CFO. And thank you for the additional increase of $4 million to pay for the BRT. Before we got $2 million a year, and it takes about $4 million to operate the BRT each year. And I have a schedule of those costs if you care to see it, but we provided that to Chaz Mitchell, and we appreciate your funding for the BRT.
Council Adam, you have questions?
Well, I wanted to know, on the fixed routes, have all the changes been made that are going to be made, at least in the, I guess, the nearby future, because I know nothing's ever fixed. But have all the changes been made so that customers now know where to go and what to do if they're routine riders of the bus?
Well, our attention peak speak to that, but we're constantly making changes. They have not all been made at this point.
So people might still see more routes canceled, or?
So let me address, yes, my name is Martine P. Finney, I'm the Senior Director of Planning for BJCTA. As Chief Dickerson is speaking to, of course, in the role of public transportation, nothing is never settled. The goal is we try to remove the word eliminate and discontinue and look for words more reassigned, because the routes may have been removed from out of the neighborhoods, but there are other opportunities for other public, transportation, like the on-demand that we're working on with VIA, and also our own internal microtransit system. So we are looking to do a complete route redesign of the entire system, and we're going to do it in phases. As you may or may not know, we have to abide by our union contract. Our bus operators are contracted, and based on the union rules, we have 3 sign-ups a year. It's January, May, and October. Depending on those months, we may go to the union and say, hey, we may need to change this to the next month, but typically we try to make changes within those allotted times. We're looking at some proposals for October, nothing like really major, maybe, portions of the routes where the city, where the routes are kind of not doing a lot at nighttime. We may be looking at cutting some of the routes, well, taking some of those times back and reallocating those hours into the schedules to make them more flexible and more efficient. If you look at some of this, the service right now, the patterns are very, inefficient. If you are a choice rider coming to the city, it's kind of hard to really know where the bus go and how you travel because of the way some of the schedules are complexed. We're beginning to make those changes. May showed a significant increase to, we're on the right track. We made those changes to the system back in May, and most of those routes are now one pattern. We know where the bus is going inbound, we know where it's going outbound. We still have some work to go and some ways to go. The goal is between this October and maybe before the end of next year to kind of see a totally different system. It may not be as it relates to all the route changes, but making some small decreases or increases where it relates to time of the day. Sleeping buses at 10 o'clock at nighttime that are kind of empty may not work. So we can reallocate those to put them more towards the on-demand service for those rides.
And how do people who don't have computers figure out what your schedules are?
Well, there's a lot of ways.
Do they call on the phone or
Yes,
just?
ma'am. Yes, ma'am. So we have a call center that caters to that. And then, of course, we're open. Our customer care department go out to different locations, like we went out and talked to the workshop. So we go out, if we're invited to come out and speak about the schedules, or if there's a person or an individual inside the agency, sometimes it takes a little time to sit down and just kind of walk the schedule through, especially for a newcomer. But a lot of times, they're really, they come to Central Station a lot and they get those schedules and, paper schedules. So we feel like it works for them. Whereas, of course, digital doesn't work for a lot of people. So one of the things we want to make sure we did not change from our end is taking away the paper schedules from the public.
Well, that's good. There's something else I was gonna ask, but now it's gotten past me, so I guess I'll have to call you.
And one thing for the council, I did make sure I send these reports over to the transportation committee, and then of course I copied. I made sure, I said, please make sure that all of the councils get a copy of these ridership reports, because what I did at the bottom highlights each one of your district and the routes that you represent as well.
Oh, I thought of another question. Okay, if a person is on a route that's been discontinued, whatever word we want to use, it's not there anymore. How do they know what their alternatives are for a new way to get where they need to go?
So we try, we have to, abide by FTA rules, it's the Federal Transit Administration. So 30 days before we make any kind of changes, we have to put out public notice. Depending on the severity of the changes, we have to do public meetings. So a lot of times they're not served to be successful. We're trying to figure out ways to make them more successful. We try to have a lot of them in the evening times, and then sometimes in the midday, because a lot of our riders say that if you do it late at night, our route is done at 7, we can't get back out. So we try to do some in the morning, midday, and also in the evening. Like I said, they're not serving to be successful, so helping at the neighborhood level would really help us really get the message out to all of our riders. We're trying to figure out ways to kind of make it more, spread the word a little bit more. The last meetings did not serve to go as well as I thought they should. We should have had more people to attend those meetings, but of course they didn't. We had a few come out, and the public, the notices are on the buses, so we have displays at the kiosks, so it's out there. Of course, but someone's gonna get missed.
Yeah, I just wondered about the communications, especially people who don't, they use
Yes,
their
ma'am.
phones for something, but it's not for finding out what's going on with
Yes,
trains.
ma'am. Yes, ma'am.
I'm sure they use them, but anyway, that was it. Thank you.
Okay, Madam President.
Yes, thank you all very much. I do have a couple of questions, and I do want to piggyback on one of Ms. David's questions. Just that awareness, I do want, when I see people standing and they're waiting on the bus, I did wonder about the communication. How do I know what time my bus is, so that I can factor that in if I'm going to work or have a doctor's appointment? Or is that education made to the public that in those areas where the on-demand service is necessarily right? But, you know, in those cases where maybe, in this case, I don't take a bus, but I take BRT or I take on demand. So is that communication made readily available or, and I'm asking a question with a statement. Also, I do appreciate that we're getting those, that information. I think you made that aware to us at the last committee of the whole, the council meeting, because I would like to pass some of that along to my residents, because I think the information you have in there gives them, you know, you can stop their facts about what is and isn't happening with the transit system.
Yes, ma'am. So,
We have
to
schedules
answer
too.
your question
Yes.
for that, so of course it goes back to Council Abbott's. If your person is not technically savvy, of course, it creates a barrier. Because we do have an app, it's called MyStop, that you can track your buses. So there's a MyStop app, or you can download, and it has all of our routes. If you don't do the MyStop app, of course, like I said, the paper schedule, that kind of speaks to you at the time point. So if you're gonna look for a stop in between, you have to kind of, I use the word guesstimate, you know, when the bus is gonna get in between here. Or, you know, of course, the website, maxtransit.org, you can go there, and then it's the same MyStop for, trip plan. And it'll tell you where your closest stop is and what's accessible. And if I'm not mistaken, the VIA portion, Birmingham On Demand is included with that as well. We get a lot of questions about the Birmingham On Demand, and we're working with VIA. We have a weekly meeting with them, so we're working out logistics, making sure, because one of the questions came back about handicap accessibility. We had a guy that was really struggling with that, and we found his response to be true, because he mentioned that he got a ride and found out that the driver stated, she was honest, that I have not been trained on wheelchairs. So working with the VIA team, we kind of went through the logistics, and then we made sure that rider got free courtesy rides, kind of courtesy coupon in his next ride. So we're working through that and making sure that everyone is being picked up. And we just call, and that means that we had to get a supervisor out there. We have our dedicated staff that have also left from behind their desks and really dropped off people who have been waiting for a long period of time as well.
I'm gonna do something else. I do appreciate you giving us these time frames that you are allowed to, the allotted time frames when you have to make changes, and then I think for the public end, you can have that awareness also that, hey, it's October, we may be having something that's gonna happen during that time. I would like to ask if you would include in those communications that you're giving to the transportation department, and now to us as well, more advance notice of when you're having these public meetings, so that we can start to communicate that to our residents as well, and maybe that can increase participation.
Yes, ma'am. And I wish you all, like I said in the past, and I do apologize, we've been copied on it, but you're right. The last notifications and package I put together, they had them in there. I mean, I just removed the May connectivity information out of here just for this July package. But the previous month before, I had all of that in there, so I can make sure you're right to include, because I think it's important.
Thank you. And my last question is really for administration. Now, I know in the past, we have not paid this all at one time. How is this?
It's quarterly. We pay them
It's
quarterly.
Okay, thank you. That was it. Thank you very much.
Thank you.
I think you guys did a great job of asking questions. I don't have any. Well, there's been a motion and a second. All in favor say aye.
Aye.
Item number 17 passes. Thank you, guys.
Thank you for your support.
Yeah. And then last item is item number 20. This is, for the fair mental deal with Jefferson County Sheriff, the city, and JD to provide fair evaluation of mentally ill persons for an amount not to exceed $100,000 per year for a term of 3 years.
Okay. So I'll tag team this one with Attorney Stanley, but this is a renewal that probably predates a lot of us. I went back and saw it's been an agreement with the UAB and the Care for Mentally Ill since 2008. Oh, hey. So this is basically for our police department that we work in conjunction with the sheriff department. Also, if we encounter anybody that we feel is mentally ill, we transport them to UAB in order to get services because we can't handle that internally nor at any jail. So Right now, this is just a 3-year agreement that we, not to exceed $100,000 per year, just to keep those services, continued and help us, like we always say, is another tool in the tool box for public safety. So, have any questions, we'll entertain them.
Council Abbott?
So these mentally ill, mentally disturbed people, the only way they would get into this program is through contact with the police or the Jefferson County Sheriff's Department, or is there some other way?
Go ahead, it's police.
Yes, Jim Taylor, Office of City Attorney. This is set up pursuant to state legislation, and it basically follows the procedure of the legislation. It is for when law enforcement for the city or the county encounters someone they believe may be mentally ill, there's a provision that they can be taken to a hospital and give an evaluation. They have to have reasonable cause, is the standard. And so the contract has been with UAB, and attorney Cynthia Winston Brown, and I've worked with many times in this contract in the past. There's a provision where the probate judge will have a hearing on probable cause, and then based on what that outcome of that hearing determines how the patient is then treated. But the agreement is intended to track what the legislation authorizes.
And we provide that legislation in your packet if you want to. It outlines the actual procedure, like Mr. Stanley said, about how we integrate those people or those persons into the system, to UAB.
Okay, so, but say if there was a mentally disturbed person in the middle of the street in 5 South, and the police came and picked them up, and they were obviously having a problem, then the police officer would drive them to UAB, and there would be an intake person who would take custody of that person, and the police could just go back to wherever they came from.
For some, and I apologize, it's Cynthia Ransburg Brown, I'm one of the University Council at UAB Hospital. We have law enforcement that brings individuals to the hospital under Act 353. UAB is the designated place in the statute for our county. I believe for a period of time, we were the only county in the state that actually had the 353 program in place because it does have a population threshold. But when someone is picked up, law enforcement will bring them to the hospital. They will remain with the patient if the patient is violent. If the patient is not violent, then those law enforcement officers are released to go. The psychiatry will perform an initial assessment. If they need inpatient treatment, it may take a minute to get that inpatient treatment, but they do remain at the hospital, and we do eventually make them inpatients at the hospital. If there's additional procedures beyond that, requiring involuntary commitment or something of that nature, we do work with the probate court. But otherwise, anyone who is picked up, reasonable cause that the person are reasonably believed by officers that the person has a mental health issue, they are brought to UAB Hospital. On occasion, they will go to other hospitals, but normally they will bring them to UAB Hospital for assessment.
Thank you.
You're welcome.
Madam President?
Thank you very much. So I know this is in conjunction with the county, but for purposes of our contract, this is anyone that's brought in through Birmingham City or by Birmingham Police?
Yeah, it's just, we encompass the county because it's an interlocal agreement between us and the UAB, including the county, because they detain people also. So that's why they're on there. But they fund it out of their money. We fund it from our money. Yeah.
And I don't know if you have the data or anything, but I was just curious. It seems like only $100,000. So this is just for the transport. Is this the actual?
It's
the actual care.
It's the care. So I get the actual data, which is sensitive and we can't really share because it has people's names in it.
I was just curious as to how often or how frequent.
I can provide you the invoices that we can, and it lists the number of people that we are helping. But it's another part of it that actually has the people name that I don't even look at.
No, I was talking numbers.
Yeah, I can provide you. I can provide you the most recent invoice that we received.
Most medical care is so expensive.
Yeah.
This is just.
And it breaks it down by the level of service that was given to those patients.
And if the individual has third-party insurance coverage, if that individual does have it, then we will seek that information out. But oftentimes they are without coverage, or they're underinsured or uninsured.
Thank you.
Well, I don't have any questions, actually. There's been
hospital, then if they send violent, then the police officer has to stay there. And then that means he or she is not out on the street, and we have this severe shortage.
Well, I don't want to speak for UAB because they have their own police department, so I don't know if there's a handoff. Sometimes,
Oftentimes there is a handoff because we do maintain police officers, UABPD, in the emergency room.
Right.
But there has to be at least an initial assessment.
Yes.
And the agreement actually provides for the police officers could be released to go and then protect and serve the rest of them.
Yeah.
Yeah, sometimes it seems like UAB has more police than we do. Well, especially for the amount of campus they have a lot of police. Anyway, that was just a concern due to our shortage.
Let me ask this, I feel like we've asked this question, more for administration, having social workers actually go along with the police when they get calls like this? There are a lot of cities that actually do that or have a separate hotline, which I know statewide, we already have a hotline, like the call number, but city-wise, having that call number, I forgot what the call number is, like in Atlanta, there's something separate. Have we looked into that?
So, using our ARPA dollars, we are trying to like close that gap of having more social workers, mental social workers,
Yeah.
with this initiative. So that'll be coming before the council pretty soon.
Oh, okay, that's good. I'm happy to hear that. Well, there's been a motion and a second. All in favor, say aye. Aye. Item number 20 passes. Thank you, guys.
Thank you.
If there isn't any old new business, the next committee meeting will be on